Good evening, everybody. Thank you for coming. Can everybody hear me okay? I have a little bit of a cold, so please bear with me. Yeah, I know, it'll help a little bit. I'm Michelle Palladini. I work here in Norfolk Police. I spend half my time in the schools as the school resource officer and the other half of my time in the detective division. I am flanked by Officer Farrah Gray, who is also an officer here, and Officer James Hazeldine, several other representatives from the department who'd rather hang in the back or lurking around to assist as needed. We also have representatives from our fire department. Grateful for having them here as well. This is the second community meeting that we have done this year so far. This is going to become an ongoing thing that we would like to offer to the community. We'd like to offer meetings each month on various topics that are affecting the community. Some are topics that residents have specifically requested from us. Some are topics that we feel would be great for getting information out. With that being said, tonight's topic is going to be on the heroin epidemic. Everybody is here because I'm sure you're either A, interested in finding out how it's affecting our community, B, maybe you have a loved one, friend, or family member who is affected by this. Whichever the reason may be, we're thrilled that you're here. And any questions, please feel free. This is a very easy format. And I'll turn it over to Officer Gray. She put the majority of this PowerPoint together, so we're very grateful for that. So I'll turn it over to you.
Okay. Basically, tonight we just want to give a brief overview of the epidemic that's going on in Massachusetts and across the U.S. today. We also have a representative from Norcap, Notis, in the audience. She works at the treatment facility and is a nurse there, and she'll be able to speak about the medications and treatments available near us. And then at the end, we can have a question and answer session. We can actually do that as a group or privately, open, comfortable situation here. The Massachusetts rising opioid crisis. As you can see, back in 2000, we had 334 unintentional deaths from opioid overdoses. And as of 2014, we're up to 1256, which between 2011 and 2014, we doubled our numbers. This is from the Department of Public Health, and based on the available data from October 15th, there's supposed to be about 200 more deaths by the end of the year.
Just one thing, mind you, I'm sorry, so those are just reported. There are many people that are not reported. Just so those numbers, even though they look large, there's probably still much more out there.
And that's a good point, because Springfield and Worcester are unable to keep the proper statistics right now, so we don't have that exact number. So think about Worcester and Springfield being completely out of that, those large cities in our state not even included. This is just another graph, more statistics to represent how it's rising in our state. 18.6 deaths per 100,000 residents for 2014 is the highest ever for unintentional overdoses by opioids. What are opioids? For those of you who don't know, they're pain reducers. Prescription medications like Vicodin, OxyContin, fentanyl, those all fall under opioids, as well as what we all know, heroin is part of that.
We're starting this discussion even earlier now as well with the children in the community too, because frequently what we're seeing is these pills are very marketable for kids. They're very accessible. You can find them in most parents' medicine cabinets. And this is frequently how it will start, is with these types of pills. So we are beginning the education for kids as young as middle school right now. Actually even younger with our DARE program. We're educating even younger with regards to this.
One of the things with the pills and the prescription pain medicines, people that are starting out with this, they're younger, just like Michelle said, high school age kids, and these kids, some of them, obviously most of them, never had any experience with drugs, never would think they wanted to do drugs. Just straight A, like, you know, Joe American, American high school kid, no problems. They get injured, they start taking the meds, they're overprescribed, or they're just not responsible with them. Next thing you know, without even realizing it, they're hooked. They're hooked, and they're on the pill. They're hooked on the pills. It starts with the pills, and when that doesn't work, it just progresses to other methods, and eventually it leads to heroin. So, you gotta think whether it's a young teen, even a family member, or anybody that's involved with you, that it just could be something as simple as a toothache. Went to the dentist, had a root canal. The dentist prescribed, a Percocet or a Vicodin for them, or a 30-day supply. They used it, and without even realizing it, they become attached to it. What's the word I'm looking for? Dependent on it, and they don't even realize it. And a lot of it's not just Joe Junkie. It's not the guy, hiding in lurking in the woods or hiding in the street corner. It's just everyday people, which is the most frightening part about this whole epidemic is that it's affecting everybody. It's not just the guy that dabbled in marijuana or weed when they were in high school, or started drinking in high school, progressed. It's not like the gateway drugs aren't opening up all of a sudden they're becoming heroin addicts or heavy drug users. It's just anybody that's the pain meds can be prescribed to anybody for anything. I'm sure many of us in here have had any type of surgery or anything like that. You've been prescribed them and have used them. It just snowballs. So.
As Officer Hazeldine was speaking of prescription drugs leading to the heroin addiction, 4 out of 5 cases are said to lead to heroin addiction. So when somebody goes in for treatment, 4 to 5 people say, I got hooked starting from prescription drugs. Prescription painkillers are prescribed to patients to reduce discomfort from ailments such as chronic lower back pain or sports-related injury, as Officer Hazeldine alluded to. Since opioids are extremely addictive, the patient may believe that they need to increase their prescribed amount. They may feel like what they had been prescribed before is no longer working for them, because after time they're like, this is enough, their body wants more. So they may go and try and get an increased prescription, and that can lead to increased cost. Heroin cost to prescription medication is a lot smaller. And when you go on the street to buy heroin, you're not being asked by this doctor or that doctor exactly why you need it, right? Might be a little bit easier. Right now, addiction is one of the states in the US that recognizes addiction as a disease. So that means that it is no different than somebody who has diabetes or somebody who has problems with fixing their habit and are predisposed to heart attacks and that sort of thing, which is why we need to think about the treatment of people who are addicted to opioids differently. We need to be able to get them into hospitals, give them treatment, and let them leave with medication and that if that's what they still choose to do. And the bottom part of that slide, Officer Hazeldine also talked about is how it does not discriminate across socioeconomic borders. So age, race, gender, it doesn't matter. It's hitting everybody. High places, low places, in the middle. There are many people being affected by it.
This includes Norfolk as well. Everybody here, is anyone not a Norfolk resident that's here? It's okay if you're not. We won't kick you out. It is affecting Norfolk, okay? Yes, we have heroin in Norfolk. Yes, we have addicts in Norfolk, okay? We bring that up because every town has it. This isn't a problem that's unique to Norfolk. This is a problem in every community. That's the purpose of having this meeting today. So I just wanted to be clear on that. Is it at epidemic proportions? It is statewide, and we are seeing it here, okay?
Signs of abuse. When you're looking at somebody who you may think is involved with prescription drugs or heroin, you can look for smaller pinpoint pupils, track marks on the arms, itchy, scratchy, overall unhealthy look. Although I will say it's a misconception that they get that skinny look to them, people can still carry weight to them when they are using heroin. So that might not always be the telltale sign. You want to be able to look at all of it together. You may also notice vomiting, constipation, for women not receiving a monthly period, depression, nodding off to sleep, using laxatives, maybe they're not hanging out with their same friend group, maybe they're not interested in the same activities that they used to be involved in. All of those come together. Did you want to talk about this?
Prevention is key. That's one of the biggest reasons we're here today. Does everybody know we have a drop box at the station? Yes, some no. Inside our lobby, we have a drop box, so you can turn in any prescription medication that you have. We're happy to collect it. It's a safe way of getting rid of it. We do not advocate throwing it away. We do not advocate keeping it in your cabinet for maybe future use in case you get re-injured. We see that a lot. And frequently what we see, especially when young children are turning to these drugs, kids want to experiment, right? Oftentimes when we were kids, it was going into the parents' liquor closet or liquor cabinet. Now they're going right for the medicine cabinet. These things are so widely prescribed now. Think about it, you go for a toothache and the doctor's like, hey, you want some Vicodin? It's like, no, I just said I had a toothache, So it's being really aware of how prevalent these drugs are inside our medicine cabinets and being able to properly dispose of them. To that end, everybody should be aware too, and this goes if you have younger kids, teenagers, college age, things of that, people of that age. You want to let them know that they can always refuse medication. If the doctor says, hey, I'll prescribe you Vicodin, you can always say, no, thank you, I'll be fine with 4 Advil, okay? So you always have that right to refuse. That kind of seems common sense to us, but especially for the younger generation, they think, well, I have to take this medication. You never have to. Keep an eye on how many pills you have. Very important. How many of us count out our pills? I'll be the first to admit that I don't. I don't have narcotics in my house, but if I did, I would certainly be keeping count because you don't know who's in your house. I had a case before where somebody was missing pills, and it turns out they had a party at their house over the weekend, and lo and behold, some of their narcotics went missing. They thought, my friends, none of my friends would do that. Well, somebody did, and it was all adults in the house. So important to be aware of. Don't share prescription medication. We see this from time to time. Have you ever had a friend that says, oh, hey, I've got a pain pill that will help, your back hurts. I have pain medication I can give you, just take one. Again, seems like common sense, but especially if you have college age kids, never, ever, ever share medication.
And if it is illegal. Yeah. If it's prescribed to you, it's for you.
That too.
Identifying signs of an overdose. So a few of our officers have showed up at overdoses in town. We do have them. 2013 we had 11, 2014 we had 11, in 2015 as of date we've had 10 overdoses that we've provided with Narcan and 1 fatality in our town. So our emergency services are responding to these, and if we can get there as soon as possible, that benefits the person being victimized by the most. So what you want to look out for during an overdose, if somebody is heavy nodding, they're looking like they're falling asleep, they're kind of doing this, sort of like that woman right there. She might just be nodding off. We see it happen in cars too. Sometimes people like to shoot up in their cars. Maybe you see somebody in the parking lot, they're just chest and head over the steering wheel. Check on them, give us a call. Blue lips, blue fingertips, slow breathing, very limp body, and a very pale face, choking sounds or gurgling sounds. As always, dial 911 in the case of an emergency. I was speaking with one of our officers the other day who had responded to one of our overdose calls, and he said he vividly remembers that slow breathing in the pale face of the person who was going through it. So really take note of the way that person's breathing, and if they're not responding to you, call us immediately.
I think it's important to bring up just the sense and the notion of community. This is a community meeting and we're talking about coming together as a community. I think a big part of that is being a positive bystander. So you see something, it doesn't look right, call us. So frequently we go to calls and people will say, geez, I would have called, but I feel bad. I didn't want to bother you guys. You're not bothering us, it's our job. If somebody looks like they're passed out behind a wheel, please call us. If you might think, oh, okay, maybe they're just sleeping. It's the Walgreens parking lot. Maybe, the guy's just waiting for his wife to come out of the store. If it doesn't look right, call us. You can call anytime. So let's create that culture of being positive bystanders and calling when we see things.
Question, go ahead.
Do you guys, all the paramedics and you guys carry Narcan?
Yes, all the
Okay.
officers carry Narcan with us along with an AED.
And
So
does the fire department also?
the fire department has. And
We'll have the fire department come up now and say a few words.
Yes, we have,
Good segue.
we do provide all ALS, advanced life support.
Okay.
So we carry Narcan, which reverses the effects of narcotics. We also have, if we can't reverse the effects, we can put the intubation, we can intubate people and bag off masks and so on and so forth. And usually the Narcan works, but unfortunately if we don't get there in time, it doesn't. So time is of the essence when you notice something like that. Any other questions on it?
Firefighter Yunker, Norfolk Fire.
And to back that up, yes, all officers are trained, every Norfolk officer is trained in Narcan. We all carry it. Every patrol officer, every patrol car has a kit in the car.
So the
Did you
Mass-
see this recently?
So, the Massachusetts approach. Governor Charlie Baker testified before the Joint Committee on Mental Health and Substance Abuse alongside Boston Mayor Marty Walsh and Christopher Barry Smith, the first Assistant Attorney General from Attorney General Maura Healey's office, in support of the governor's bill. This bill, I don't know if all of you are familiar with it, he's been very active in getting these laws into play. It's called an act relative to substance abuse, treatment, education, and prevention. And it has quite a few things regarding how we're going to attack this problem as a state. He also mentions nearly 4 Bay Staters are dying every day, 4 people from this. And we want to become this state without stigma. So the thing they're doing right now is trying to take that stigma away from people. This isn't something for anybody to be ashamed of. It can happen to any one of us or any one of our family members. Things relative to this act. What Governor Charlie Baker wants to do is he wants to increase continuing education requirements for practitioners. So that means he wants our doctors to be having more training about what needs to be prescribed, how much, and to who. He also wants to reduce excessive prescribing practices, increase the prescription monitoring program, which is basically a database for doctors in Massachusetts. When somebody is being prescribed an opiate, they're going to be put into this program, and it's on the website. Doctors are able to get into it, so we can say this person got prescribed this drug at this time on this date. So there can be no more doctor shopping, because what a lot of these drug users are doing is shopping around for the doctor. Oh, this doctor won't give me it, I'll just try the next doctor. This doctor won't, I'll try the next doctor. And they do. So they're getting all these prescriptions from all these different doctors, and Charlie Baker wants to try and stop that. He also wants to educate athletes and their parents about the dangers of opioid use and misuse. I was talking to one of my neighbors the other day, and she has high schoolers, middle schoolers, and elementary kids. And I was talking about how the community meeting was going to occur on the drug forum. All of her children are involved in sports. And she told me that now she has to tell her children not to use heroin. That was never prevalent when I was in high school. My parents never had to tell me not to use heroin. It was kind of implied. And same with abusing prescription drugs. It was kind of implied. But now it's the norm. Now it's kids at the lunch table taking out saying, hey, you want to try this Skittle or that Starburst? It's the same thing, except it's Vicodin and it's Percocet. Moving on. It improves the treatment options for patients involuntary committed under Mass General Law, Chapter 123, Section 35, which allows you to go into the court system and involuntary commit somebody you believe may have a problem. Sometimes this has been working for us, sometimes it is not. I know that we have tried and failed in Norfolk because of the laws that they have currently in place. It also is going to create a new emergency admission pathway to treatment. So what they're going to try to do is work with the hospitals and treatment centers. So it's that multifaceted approach. So instead of hospitals saying, oh, here, you're in here, you got Narcan, you overdosed, we're going to watch you for 4 hours and then let you on your loose. What they're trying to do is make sure that person gets into a treatment immediately. Also, it's going to increase the transparency of insurance carrier opioid policies because of different insurance things that I can't speak very educated on, but moving on.
A lot of the issue too is the availability. You don't have to raise your hands, but I know there's people frequently that will say, I just can't find help. There's no beds available. and I see lots of heads nodding. We understand that struggle. We run into it frequently. Yes?
Just to kind of capitalize on what you just said about the insurance companies, it went into place October 1st that the insurance companies now, the bill was passed. So instead of family, it is still hard to find a bed, so I don't want to mislead anybody, but at least now we're not trying to get those pre-authorizations with some of the insurance companies. We actually can take someone into treatment and then we have to notify the insurance carrier within 48 hours that they're there. And then on the 7th day, we used to just do what we'd call a spin dry. Somebody would come in and we'd be getting them out the door. If it was an alcohol, you'd be out in 4 or 5 days. Opiate, 7 days was a blessing if you were there for 7 days. Now what the new law says is 48 hours we have to notify the carrier. On the 7th day, they can request a utilization review, but we're actually keeping people up to 14 days. So maybe the protocol is completed, but there's not a bed available at a CSS, which is a clinical stabilization support unit. So they're at least staying in the hospital. We're in acute detox, but they're staying there. They're still getting comfort medications. They're not getting the protocol medications that we use to take people off of heroin or any of the other opiates that they're using, but they're still attending groups. So there's at least a little bit more time for our counselors to find placement afterwards, if they so choose. And if they're not looking for long-term treatment, at least to find them something in the community that they can go to, instead of just coming in. That was a failure. People came in, they went out, and they failed because there was no support system for them. So that's a great change that happened October 1st.
Thank you, Kathy. Kathy's from Norcap.
I was just going to
I work in Norcap, which we're in acute detox.
Right.
I'm a
My son has
registered
been there numerous times,
Oh.
but that's a huge positive plus.
It is.
Because my son would go there for 5 days.
Right.
And then boom, back home to me.
Right.
And another thing that I think we have to work on, or with insurance companies, is that I have detoxed my son at home, and then I would find a DPH bed, and in order to get him in, he had to be high. And I'm like, are you kidding me? So I honestly, I just gone and bought my son heroin to get him into a bed, because, and that's pathetic. That is absolutely pathetic. And that's, something's gonna change with that. I don't know if it's still, I mean, one
There's a
time.
criteria, that is true. So if somebody goes to the emergency room and they say, you know,
Yeah,
that I used, but I've only been using for 3 days. I was in detox 2 weeks. If they leave against medical advice, there is like a criteria, they're not gonna take them back for 30 days. If they go on a regular discharge, it's 2 weeks. But if somebody goes into the emergency room and says, oh, I've only been using for a day, it's hard to get them back into
I took
treatment.
my
So
son
it's
the
another
first time
facet.
he ever accepted treatment. When I went to the emergency room in Norwood Hospital, and spent all night nodding off. I was mortified. I mean, I'm not mortified, but I mean, devastated. I mean, my son was dying in front of me, basically. They told me they got him a bed at Norcap. So I took him to Norcap, and he came out crying, saying that I can't even use enough to get help. Now that was,
It doesn't,
that was
then-
like 4 or 5 years ago.
Yeah.
But that's sick.
Yeah.
That's sick.
Yeah.
I mean, and so what did he do? He came home and he did a good, he went on a bender. And thankfully got help, but how do you not use enough drugs to get help if you're asking for help? It doesn't matter how much you use.
Right.
If you're there and you want help, it's the first time you ever asked, you should be able to get it. And
Well, that is one change that's positive.
Oh,
I mean, there's a
thankfully,
lot of positive things.
I always
that
called
happen.
Norcap as a spin dry. I said, oh, no,
Spin
it's a
dry.
spin dry. I'm not, don't even talk to me.
Of all the detox centers, though,
Right.
we all do the same thing.
Right.
And it was all insurance driven, of course, like
Absolutely,
anything.
yeah.
There isn't enough aftercare programs for people, that's starting to change as well. I think it's great that people can stay. I have people who are still there on their 12th to 13th day. I've been there for 10 years. That never would have happened last year.
But I mean, these people need
They need aftercare.
They need 18 months. I mean, they need, a heroin addict does not need
They need
3
a lot
months.
of aftercare.
Absolutely.
They do. They need to have services in place in the community that somebody who is struggling with the addiction can go to, whether it be the Suboxone. I'm not saying that the Suboxone and methadone clinics are the answer, but they need to have, and they need to be vested in going. I don't know what it is about the 12-step program, but it works.
Oh,
And the
absolutely,
ones that are
yeah.
successful
Mhm.
are really involved in their recovery,
Right,
aside from the medications that can help with some of the symptoms that they
But
experience.
aside from, I think they need to be in a, their brain is so messed up
Mhm.
from using that even 6 weeks is that's not gonna do it. They need whether a CSS or a TSS or a long-term program that's gonna help them get into.
And transition back into the real
Right,
world.
right.
I
And
agree.
working
I agree
with,
you.
and, it's
Going
just-
back into the real world.
I agree.
Right. So what I think what Massachusetts is trying to do is go with a stop the stigma. So we want to take that stigma away. So when somebody goes through their recovery and their treatment and they're trying to get back in to a regular social standing and they want to be part of their community again and join society as a contributing person, we need to drop the stigma and allow them to come back and welcome them and help them and support them.
Right.
And I think that's what Governor Charlie Baker is attempting to do with a lot of the things in this act relative to the substance use treatment, education, and prevention. So regarding that, I do think that there are things that are changing. I think the tides are changing. As Kathy said,
That's huge.
it's no longer that
That's huge.
spin dry that you
That's
speak
right.
of.
Yep.
The insurance companies are going to be on board. This epidemic, everyone who has been dying, all the family members who are being affected, they're putting their foot down and they're saying we need to see change. And Massachusetts is going to be part of that change. So if we can go on to the next slide and then continue a little bit. Stay Without Stigma. You go to the DPH website. On the left, you can see the first that comes up is the Stop Addiction. We have the Stop Addiction, the State Without Stigma. Massachusetts are trying to go forward and having people support this act. Actually, you can go on this website and show your support. You can write your name, say what town you're from. It's not, it's not going to do everything, but it's going to help a little bit. What I wanted to add is something that I found on the website is that objects that might be clues to use. Okay, so cotton swabs. There are also dollar bills. People are snorting heroin, they're snorting the fentanyl, they're snorting all of the prescription drugs. They want that quicker high. Empty pill boxes, cigarette filters, spoons, syringes. Maybe you've been around it, maybe you've seen it, maybe you know somebody who's been around it. We did something a while ago, and that is making syringes accessible with no, they're no longer illegal. They're legal now because the epidemic with HIV, AIDS, that sort of thing, sharing the needles was giving other diseases. So we have now made it legal for them to purchase. So now some of the people who are using heroin are going to our local Walgreens, taking the syringe, and then using that and their heroin within the walls of the bathroom at Walgreens.
They can actually be used in that.
People are going in after purchasing syringes,
Well, I mean,
and they are shooting up, for lack of a better word. So we have the pharmacist calling saying, hey, our employees are finding syringes in the trash when they go to take out the trash. They're using anywhere to use these drugs in public places because they know that if they overdose, because they took a little too much that time, that somebody might find them in the public.
To that point as well, we are seeing syringes pop up in wooded areas and places like that. Goes without saying, but please don't ever touch them, and just be cognizant. It's upsetting that people are saying I'm trying to go for a nature hike with my small child and there's a syringe on the ground. It's not just our community; it's everywhere. So us, the fire department, we can always aid in disposing those properly for you if you find them.
Norfolk's approach. Some of you may know about what Gloucester started, and that's the police addiction, next slide, police assisted addiction and recovery initiative. So what the Gloucester Police Department found was that there were so many people using heroin in their town, overdosing. The police were just upended with calls for overdoses, syringes on the ground, et cetera, et cetera. So what they're doing and what we've partnered with is to encourage opioid drug users to seek recovery, help distribute life-saving opioid blocking drugs to prevent and treat overdoses, like the Narcap we spoke about earlier, connect addicts with treatment programs and facilities, and provide resources to other police departments and communities that want to do more to fight the opioid epidemic problem. So I was talking to my deputy chief the other day, and he was talking about this one time years and years ago, that there were two people on the side of the road who looked down and out and that they needed help. And he ended up dragging them all the way up to the North Shore to find a facility so they could get help. So Norfolk isn't just starting to be all about the community and helping one another, but what we're doing is we're partnering with other departments who feel the same way we do, because it is affecting our communities and our family and our loved ones. So we want to take a better approach to it. So say a drug user comes into our department, we can assist them with getting treatment. Now that we have Kathy on our side, she can assist us hopefully by getting somebody into the Norcap Lodge. And if they bring in their drug paraphernalia that they no longer want to use, we can dispose of that for them. So we want to help.
I think if I can just interrupt for a second, this is a little bit of a plug for the Norfolk Police Department, but we do work with a tremendous group of people that really do care. And because we're such a small community, we have the ability to go the extra mile sometimes on some of these calls. So it's a great testament to kind of where we're at today and where we've always been, even in years past. I also wanted to thank Officer Gray. She took the initiative to partner us with this organization in the Gloucester Initiative, and we're all really thankful for her taking the steps to do that, so good work.
Thanks. We discussed our Narcan a little bit earlier. Medications available to assist in recovery. So there's always going to be a conflict and a controversy about using medication or not using medication. You may have had somebody who's been given it and then abuses it. Suboxone can be abused. That is true. Methadone, I don't know too much about, but I believe that can be abused as well. Kathy, is that accurate?
But a lot of them that are going for the methadone treatment afterwards, it is going someplace every single day. Suboxone, they'll start out, maybe where they go, they'll supervise them, and then they'll write a prescription, so they're coming in like maybe every 2 weeks or 30 days. The Vivitrol, which is new, and which they're having success with, and it's a compliance issue. People are only having to go to the doctor once a month for the shot. It's a long-acting, and they're having success with it. And they don't need a special license for Vivitrol, so your own PCP may be administering the Vivitrol.
Now, is the Suboxone still a special license?
It is. Suboxone is.
So that's a moneymaker.
Well, yes, I mean,
That's
that's
a moneymaker.
what they are.
Most
They do
prescribed drugs
require-
are.
What I mean, yeah.
But they do need to hold a special license to dispense Suboxone, and there's all kinds of things, they can only have so many patients, et cetera. But the Vivitrol is showing success, and it's a compliance issue. Some people, they've been on the Suboxone, they're at home, they abuse it, or they decide to sell it and then go right back to using heroin. Where Vivitrol, they don't have to, I gotta go to my once a month appointment. I get the shot, it decreases the craving, so we're seeing success with it.
Now,
It's new.
Kathy, let me be aware that 31 Pine Street, our Pondville Medical Center, One of the doctors there is a primary care provider, Dr. Bahrain.
Yeah,
And-
he's doing it, but he is accepting some new patients. You
Okay.
would have to call and see, and, I hate to say it, but it is all based on insurance.
That's the
It's
new
the
building
new
on
pond.
Yeah.
Okay.
So accepting new patients.
And that's
But
for
they
That's
are
for
accepting.
Vivitrol.
Yeah, and he is someone local who's doing it, but his office is accepting new patients. So he would have to be a primary care physician in order
Right.
to receive it. But your own primary care physician
Yeah.
may be administered.
I mean, it's not even an issue for my son, because he had an adverse reaction to it, so, but I'm just thinking,
Yeah.
like, yeah, I mean, it's just someone local that,
That is, yeah.
Local resources available, Riverside Crisis Emergency Services. They give out intervention for substance abuse and mental illness. They're open 24 hours, so they have clinicians available to help you bring somebody in their time of need. They do evaluations of both adults and children, which is a positive. Norcap only does adults.
Correct.
Is that, okay. And then there's the Children Behavioral Health Initiative, and that helps put services into place in the home, therapy, mentors, behavioral therapists, and family support training is available as well at Riverside. More local resources, the Massachusetts Substance Abuse Hotline can assist you with finding a treatment facility. And then there's the National Institution on Drug Abuse, top one adult directed, bottom one teen directed. Cushing House and Gavin Foundation, residential programs and outpatient programs for adults and children. The Massachusetts Department of Public Health, I've taken a look at a few times and they have a lot of information to offer. So I would check out that link. We're gonna have this presentation available by email if you don't want to write everything down and you're interested in some of it. Learn to cope. So that's support programs for families that you can contact. So if you know somebody and it's affecting your life, there is help out there and people who can talk to you, because we know it's not only the opioid user whose life is getting upended and upside down. It's everybody who is surrounded by them who is affected by that. And that goes on a greater note as far as our community goes. So we have these people who are abusing drugs like heroin, and then they want more heroin. But more heroin costs money, and they don't have a job because they can't keep one. So there's sort of that spiraling effect. And if you want to speak to the break-ins that we do have occur in our town, and the car break-ins as well.
Right, so the majority of break-ins that we're seeing, why do we think people are breaking into homes? Any thoughts? Drugs, yeah. They're looking for quick cash, gold, jewelry. That's what we're seeing. And it's a quick way to get money, pawn some jewelry. We're seeing it. We've had several this year. Not unique to other years. It's pretty in line with what we've had the last few years. But we are seeing it. So how it affects the community? Well, we're being affected by, a rise in home break-ins. It certainly is an effect.
Also, Narcotics Anonymous and Alcoholics Anonymous. I throw up Alcoholics Anonymous because I know they do a lot with support for the family, and Narcotics obviously because it's falling under that as well. And they both do the 12-step program differently. Narcotics covers everything, whereas Alcoholics doesn't cover everything. But they both work with a 12-step program and hold local meetings. Actually, there are meetings, is it every Tuesday at St. Jude's?
I think it's every day.
At noon,
Yeah,
okay.
every day.
And then I think they have some nightly ones too. So you can always drop into one of those, welcoming. Pharmacies in our area that provide Narcan with no prescription necessary. So because of this affecting everybody, and they go home and their family members, maybe that slowed breathing or their fingertips are turning blue, family members wanted to have Narcan available for themselves so they could give it to their daughter or sister or brother. So now we have Walgreens and CVS that do not need a prescription to get the Narcan. So you can go in there and get Narcan if you think that it may be necessary in your life to carry that. So CVS does that as well. And some insurances will cover or provide out-of-pocket expense, approximately $50 for 2 doses.
And this, even though it appears to be a substitute for calling 911, it still isn't. We always prefer that you call us.
Also, with that said, fentanyl has been recently seen a lot when drug arrests occur. I've heard from local area detectives that they're testing the drugs that they come upon in the baggies, and it is no longer heroin, it's testing as fentanyl, which is a drug that people are prescribed post-surgery that requires assist in getting off of it. So when you go to the hospital and you get your surgery done, they'll give you 30 milligrams of fentanyl or something like that, and then they'll wean you off it over a course of days and make sure that your bowels are working properly before you leave. So what we're seeing is fentanyl is what people are using, and the Narcan may not be as effective. The nasal spray may not be as effective. One of our officers did, I believe, 2 nasal sprays, 2 doses. The person did not come back until the EMS arrived, and they were able to administer their version of Narcan, which isn't nasally.
We just do it IV.
IV. Okay. So always
It's no
necessary.
different. It's no different. It's just we administer it different.
Okay.
And fentanyl is much stronger. So you might have an addict that's used to a particular dose of heroin, and now that it's either being cut with fentanyl or it's pure fentanyl, their body is reacting differently to that particular drug.
And those are just some of the resources that were gathered for this presentation tonight.
Questions? Did we cover everything you wanted to hear? Hopefully. Okay. Can I ask a quick question from everybody that's here? How did everybody hear about this meeting today? Facebook? Anyone not Facebook? You saw the sign? Okay. We're just trying to come up with different and creative ways of getting word out. We typically advertise everything we do on Facebook, but we realize that only reaches a smaller portion of the community. We probably reach about 2,000 people, we figured, through Facebook. So we're just trying to figure out different ways to reach people. That's why we did the sign board. We did advertise in the paper. Who reads a paper anymore? I don't know. A couple people, okay.
It's online too.
Yep. So we're just trying to reach out. If you ever have any topics that you want to hear for these community meetings, please, you can flag any of us down. You can call the police station. You can reach out to us on Facebook. We're happy to bring something every month to the community that's of interest, so please let us know.